Sorry, I had to cut this presentation into two. I had an interruption after the last presentation. So we were still on this slide with infections. We had talked about the different B95, 96, and 97 categories. I just wanted to finish with talking about the infections resistant to antibiotics. So again, these used to be V codes in ICD-9. They're now Z codes in ICD-10. So we have the category Z16, which are those infections with drug-resistant microorganisms. And we can take a quick look at those in our index. See if we can find those. So you'll notice that they're further broken down into the exact kind of drug resistance that is occurring. Okay, the last part of this chapter is talking about sepsis, severe sepsis, septic shock, all of those fun things. So with sepsis, so sepsis is essentially a system-wide infection, and to code these, you want to code the underlying systemic infection first. So if you don't really know what that is, it doesn't necessarily have to be sepsis. It could be some sort of respiratory infection or something like that that has then turned into a systemic infection. That's going to be coded first. If you don't know what it is, the default is A41.9, which is just unspecified sepsis. So your main term there is just sepsis, and you don't have any sort of subterm there. If you're looking at a chart that has negative or inconclusive blood cultures, typically with those you want to query their provider, because that's not going to be enough to code sepsis, but sepsis can get pretty severe, so it's something that we do want to capture if indeed that is what the patient has. Now, a terminology that you might see in the medical record is urosepsis. Physicians might be using this thinking that they really are talking about a systemic infection that has occurred from a UTI. But if you code urosepsis, let's go ahead and check it out in our index. Basically, it just codes to condition. So urosepsis in itself, in ICD-9, used to just code to a UTI, a basic urinary tract infection. Now it's not even going to give you that. So essentially, you need something more specific than urosepsis. Now, if sepsis is severe enough that it causes associated organ dysfunction, then we qualify that as severe sepsis. And that's going to code from R65.2, and then there are some additional digits there. So the way we code this, we have our systemic infection, again, whatever it is that started all of this, our severe sepsis, and then if it's in severe sepsis, that means there's some sort of organ dysfunction, so we have codes to specify exactly what's going on with those. And let's take a quick look at R65.2. Just want to see if there's any notes there. Here we go. So severe sepsis, notice it tells us it's associated with organ dysfunction. Code first the underlying infection, and then use additional codes for respiratory failure, kidney failure, whatever we have going on, hepatic failure, things like that. Now, if sepsis goes into severe sepsis and then continues, the patient can get into septic shock, which is R65.21. So again, it's the same kind of order. We have our initiating systemic infection. Now we have R65.21, which indicates septic shock. And again, if they've gone from that continuum of sepsis to severe sepsis to septic shock, they are going to have organ dysfunction, so we want additional codes to specify what exactly is happening there. Now, as always, I've mentioned pregnancy always has kind of its own little rules. Just note that there are codes specific to pregnancy and for newborns, for sepsis and newborns.